If you're managing diabetes in your later years, you might be laser focused on keeping your blood sugar low. But here's a surprising truth. For older adults, that tight control could be doing more harm than good, leading to dangerous lows that cause falls, confusion, or worse. Stick with us to learn why a safer, smarter approach to diabetes could change everything for you or your loved ones. Imagine you're an older adult with diabetes, sticking to your routine, checking your blood sugar, taking your pills, maybe even insulin, all to keep those numbers in the perfect range. You're doing everything right, or so you think. Then out of nowhere, you're hit with a wave of shakiness, sweat pouring down, your mind foggy like you can't string two thoughts together. Your heart's pounding, and you're not sure if you're just tired or something seriously wrong. This is hypoglycemia, when your blood sugar crashes below 70 milligrams per deciliter. And for older adults, it's not just a blip, it's a real threat that can turn your day upside down. Hypoglycemia isn't some rare glitch. It's a growing problem for older adults with diabetes, and the consequences can be brutal. A single low blood sugar episode can lead to a fall that breaks a hip, landing you in the hospital with a long, painful recovery. It can mess with your heart, triggering irregular rhythms that feel like your chest is betraying you. Worse, repeated episodes can chip away at your memory and thinking, leaving you or your loved ones wondering why you're not as sharp as you used to be. Studies show 1 in 4 older adults with diabetes deals with hypoglycemia at least once a year, and for many it's a recurring nightmare. Let's talk about Ora Larson, an 85-year-old grandma from Ohio who's been managing type 2 diabetes for over 20 years. Ora prided herself on keeping her blood sugar tightly controlled, hitting those low targets her doctor set years ago. But lately, she's been blindsided by episodes of shaking, anxiety, and moments where she'd stare at her grocery list, completely lost. One scary morning, she nearly collapsed in her kitchen, her legs wobbling as her daughter found her just in time. Ora thought she was just getting old, but her doctor confirmed these were hypoglycemic episodes, triggered by her meds pushing her blood sugar too low. Ora's not alone. Take Jim, a 72-year-old retiree who loves his weekly barbecues with his grandkids. Last month, he felt dizzy mid-conversation, his vision blurring as he sank into a chair. He brushed it off as heat, but his wife noticed his clammy skin and forced him to check his sugar. It was 60. Jim didn't realize his strict diabetes regimen was putting him at risk. Like Ora, he was following outdated advice, chasing numbers meant for younger patients. So why is this happening? Decades ago, doctors drilled into everyone that tight blood sugar control was the golden ticket to avoid complications like kidney failure or blindness. But as we age, our bodies change. Medications hit harder, and the benefits of those super low numbers shrink. Meanwhile, the risk of hypoglycemia skyrockets, especially if you're on insulin or certain pills. Yet too many older adults, and even some doctors, are stuck in that old mindset, putting people at risk for no good reason. The cost isn't just physical. Think of the hospital bills from a fall, the stress on your family, the fear of losing your independence. Here's the good news. You don't have to live like this. There's a smarter, safer way to manage diabetes that keeps you steady and lets you enjoy your golden years. Want to know how? Stick around, because we're diving into what experts recommend next. So we've seen how dangerous low blood sugar episodes can be for older adults with diabetes. Scary falls, heart issues, and foggy thinking are no joke. But here's the bright side. You can manage your diabetes in a way that keeps you safe and lets you enjoy life, whether it's gardening, playing with grandkids, or just feeling like yourself again. Experts are now saying that for older adults, it's time to rethink those super strict blood sugar goals. Let's dive into what they recommend and how it can make a real difference. First, let's talk about hemoglobin A1C, or A1C for short. This number shows your average blood sugar over a few months, and for years, doctors pushed for keeping it super low, like under 6.5%, to prevent complications. But for older adults, that tight control often does more harm than good. Dr. Say Lee, a geriatric specialist at the University of California, San Francisco, explains that as we age, the benefits of super low A1C, like preventing kidney or eye problems, start to fade, while the risk of hypoglycemia shoots up. His advice? Aim for an A1C above 7%, sometimes even 8%, depending on your health. That's a game changer for people like Ora Larson, who we met earlier. Remember Ora, the 85-year-old who was battling shaky, confusing low blood sugar episodes? Her doctor took a fresh look at her plan. Instead of chasing a low A1C, they adjusted her meds to keep her blood sugar a bit higher, targeting an A1C around 7.5%. They also scaled back her insulin dose, which was pushing her levels too low. The result? Aura's episodes dropped dramatically. She's back to tending her roses and joking with her daughter without that constant fear of crashing. It wasn't about giving up. It was about managing smarter. So, how do you make this work for you? Step 1. Talk to your doctor. Be honest about any shaky spells, confusion, or times you felt off. Ask if your A1C goal is right for your age and health. If you're over 70 or have other conditions like heart disease, a higher A1C might be safer. Step 2, review your medications. Some diabetes drugs like sulfonylureas or high-dose insulin are notorious for causing lows. Your doctor might lower doses or switch to meds that are gentler on older adults. Step 3, keep monitoring but don't obsess. Checking your blood sugar a few times a week can catch trends without driving you crazy. This approach isn't about ignoring your diabetes. It's about balancing safety with quality of life. For older adults, avoiding hypoglycemia is often a bigger win than hitting some textbook number. Dr. Lee and other experts stress that every year you age, your body changes, and your diabetes plan should too. Too many people are still stuck on outdated advice, chasing goals that put them at risk. By easing up on strict control, you can reduce hospital visits, save on medical bills, and feel more in charge of your days. Ready to take control with practical, everyday tips? We've got you covered with simple steps to keep your diabetes in check without the stress. Stay tuned, because next we're sharing 3 easy ways to make this work in your daily life. All right, we've learned that for older adults with diabetes, chasing super low blood sugar numbers can lead to dangerous lows, and experts recommend a safer approach with a higher A1C target, like above 7%. But how do you actually make this work in your daily life? Don't worry, it's not about overhauling everything. We're sharing 3 practical, easy-to-follow tips to help you manage your diabetes smartly, avoid those scary hypoglycemic episodes, and keep enjoying the things you love, from family dinners to morning walks. Let's break it down. Tip 1. Eat balanced and don't skip meals. Your blood sugar thrives on consistency, and skipping breakfast or lunch can send it crashing, especially if you're on diabetes meds. Aim for meals with a mix of whole grains, lean proteins, and veggies. Think a turkey sandwich on whole wheat with a side salad, or oatmeal with berries and a boiled egg. Snacks are your friend too. If you're feeling off between meals, a small handful of nuts or an apple with peanut butter can stabilize your levels. For folks like Ora Larson, who we mentioned earlier, adding a mid-morning snack cut her shaky spells in half. The key? Plan ahead. Keep easy, healthy options at home so you're never caught off guard. Tip 2. Monitor your blood sugar, but don't obsess over it. Checking too often can stress you out, and for older adults, that's not the goal. If you're stable, testing a few times a week, say before breakfast or after a big meal, can spot trends without turning your day into a numbers game. Use a simple notebook or app to track your readings and any symptoms, like shakiness or fatigue. Share this with your doctor to fine-tune your plan. Jim, the retiree we met, used to check his sugar 4 times a day, but his doctor said twice a week was enough since his meds were adjusted. That freed him up to focus on his grandkids, not his glucometer. Tip 3. Have an open talk with your doctor and don't hold back. If you've had moments where you felt dizzy, confused, or just not yourself, tell them. Those could be signs of hypoglycemia, and your doctor can adjust your meds to keep your blood sugar in a safer zone. Ask questions like, is my A1C goal right for my age? Or, are my meds causing these lows? Some drugs, like high-dose insulin, can be too strong for older adults, and a lower dose or different med might work better. Also, check in regularly, every 6 months or so to make sure your plan still fits as your body changes. These conversations can save you from ER visits and keep you independent. These 3 tips, eating balanced, monitoring smart, and talking to your doctor, aren't about making life harder. They're about giving you control so you can savor the moments that matter, like laughing at a family barbecue or taking that evening stroll. By focusing on safety over strict numbers, you're less likely to face hospital bills, falls, or the stress of constant worry. Ready to wrap this up with a plan to live better with diabetes? Stick with us for our final thoughts and a call to action you won't want to miss. Managing diabetes in your golden years doesn't have to mean constant worry or dangerous lows. By aiming for a safer A1C above 7%, adjusting meds with your doctor, and following simple tips like eating balanced and monitoring smart, you can take control and enjoy life. Whether it's barbecues with grandkids or quiet mornings in your garden, you deserve to feel steady, safe, and free to live your way. So take the first step. Talk to your doctor about a diabetes plan that fits your age and needs. Then, try those tips we shared. If this video helped you, hit that like button, subscribe, and ring the bell for more health tips. Got a story or question about diabetes? Drop it in the comments. We'd love to hear from you. And please share this video with someone who could use it. Here's to thriving, not just surviving.